Right, hello everyone and welcome to today's webinar. My name is Michael and in a few moments, as always, I'll be passing on to Helen to actually do the presentation for us today around PRN medications. But first, a little bit of housekeeping. This webinar is designed for people with medication knowledge and how to give out medications. If you haven't had that pharmacy training, you might get lost in this. This is just to help further understand your role. And if you have any questions throughout, please use the Q&A feature attached to this webinar. We will get to them at the end. Just because of a slight delay between us and you, it will make things a little bit more smoother. Anyway, now I'm going to pass you over to Helen, who will introduce herself, tell you a little about herself and start the presentation.
Hi, can you hear me now?
We can. Let's try again.
I'm really sorry about that, guys. Okay, so let's go again. So thanks a lot, everyone, for joining the webinar today. My name's Helen. For those of you that don't know me, I've worked for PrimeLife for nearly 4 years, and I'm involved in everything medication, including developing new training packages, audits, and email. Previous to my joining PrimeLife, I've worked for several pharmacists supporting care homes all over the country. And I think of myself as a people person, and I hope you find this webinar a useful support tool today. So let's begin. So today we're going to be looking at PRN medications. So what does PRN mean? PRN is Latin for when the circumstances arise. So it's called pro rata. Okay, easier for everyone just to say PRN or when required. So there's 2 different categories of PRN medication, and to understand when required medications, it's best to split them into these 2 categories. The first one is scheduled. So scheduled is when required items that you can offer or assess a need for on a regular basis at certain times. For example, painkillers, paracetamol, lactulose and salbutamol. Then there's non-scheduled. These when required items are when you wouldn't offer them to the resident or access a need for. So these examples are buccal midazolam for seizures or lorazepam. Remember, PRN medication should be available throughout the day and not just at the medication round. So let's look at when required non-scheduled. When required, PRN medications to manage a person's behaviour should be prescribed for as short a time as possible. The use should be recorded and reviewed frequently. If you have concerns about overuse, you should speak with your manager or contact the prescriber for advice. Overuse of medications to control behaviour could lead to a safeguarding incident being reported. When required non-scheduled medications. These will include medications such as midazolam for seizures, lorazepam for anxiety, and risperidone for behavioural problems. Scheduled PRNs. These will include medications such as paracetamol, fibrogel, lactulose, and often oromorph, which is a controlled drug. PRN protocols. All when required medications need an individual when required protocol that will be able to give you support on if it's appropriate to administer the medication. We should have an image on the screen for you now. If you have a look, you can see the name of the service user, their date of birth. Then we look at the medication, the form, if it's tablets, capsules, liquid, and the strength of the medication. We then have the dose and the intervals that's to be administered, and the maximum dose within 24 hours. We have then the reasons for administration, any special instructions, and these should be signed and dated. So how often do PRN protocols need to be reviewed? A set date for review of the PRN medication should be clearly stated in the clinical records to determine the ongoing clinical need for the prescriber. He must regularly review PRN medication. The medication could be stopped, or it may be necessary to alter this to a regular daily dose. On our email system, you can actually set a review date. But what's important to remember is to remove any discontinued PRN protocols that are in place. So what information is needed? Let's have a look in this in more detail. When to offer the PRN medication? How does the resident express their need? Is it by body language, a facial expression? Does the medication need to be given covertly? Remember, most communication is not given verbally. How much to give? A variable dose is when the dose is for 1 or 2 tablets or 5 or 10 mils. The quantity administered must be documented on the MAR chart, and it is good practice to keep a running balance of stock. What is the medication expected to do? Did the medication have the desired effect? Document the outcome. And on the email system, we do have the option to go back and review the outcomes. And this is really important because it gives us a real detailed information about that PRN medication. We can offer this then to the doctor to say, look, this needs to go onto a definite dose. What is the minimum time gap? The best example of this, as you all know, is paracetamol, and we should allow 4 hours before the next dose. What is important is that we document the actual time the paracetamol was given. It is no use just signing it morning, noon, tea and bedtime. We need to document the time. The maximum to be given each day. This is to avoid the risk of an overdose. Remember your 6 rights of medication administration. The right time and the right dose applies here. How long the medication should be used for before seeking further advice. In our PrimeLife policy, it states this is 72 hours, but check this in the individual's care plan and on the PRN protocol as it may differ. How to record. PRN medications need to be recorded on the MAR and coded accordingly using the back of the MAR chart. On the email electronic record to detail all reasons for either offering or administrating the medication. As we said before, it's important to document the amount given, especially on variable doses, 1 or 2 tablets, 5 or 10 mils. It's important that we record the current balance on the MAR chart. This will give a good audit as all PRN medications should be in their original box or bottle. Good practice is to keep a running balance. The email system will automatically count the stock for you. Always document on the reverse of the MAR chart why the medication was given, and especially the outcome. The email system, as I've said before, will prompt you to go back and review the resident. You can only sign for the PRN medication when it has been administered. Remember to stay with the resident until the medication has been witnessed as taken. And always remember to follow your 6 rights on PRN medication also. Have I got the right person, the right medication? Is there enough time left between the last dose and this dose? Is the dosage instructions correct? Am I administrating it via the right route? And as we've said before, the resident always has the right to refuse. Recording a PRN administration. PRN medications still need to be recorded on the MAR chart and coded accordingly using the back of the MAR chart, as we've said before. But always remember to try other things before a medical intervention for non-scheduled PRNs. Remember your PBS training. As we said before, we should document on the back of the MAR chart today's date, the time, and as we said, this should be an exact time the medication was given, the medication and the quantity, the reason for the administration. Was it a headache, pain, anxiety? The staff initials, and this is really important, who gave that medication and then who went back to review the outcomes. Where we have documented a result, we need to make sure that we put this in full. So, has the medication has the desired effect? If the medication is in a bottle because it's been halved by the pharmacy, just remember that we should always have the batch number and the expiry date on the pharmacy label so we can carry forward this medication. A good example of this is lorazepam. So when you're booking in your medication, always remember to check there's an expiry date been put on by the pharmacy and the batch number is on there. The storage of when required medications. PRN medication should be stored securely and easily accessible to the resident on request. PRN medication should be stored following PrimeLife safe handling of medication policy and procedures. You can find the storage requirements on page 12. PRN medication should be kept in their original packaging and have a pharmacy dispensing label attached. Some residents may want to keep their salbutamol inhaler or their GTN spray at hand. This is fine, but make sure it is documented that they keep this medication with them. They are self-administrating it on some occasions, and this needs to be documented too. Keep appropriate stock levels that meet the residents' changing needs. If PRN medication is left over at the end of the monthly cycle and it's still current and in date, the medication should be carried forward to the next cycle to avoid unnecessary medications waste. With the EMAR system, we're able to look at medication waste more accurately. Should PRN medication be discontinued, medication must be disposed of in the appropriate manner. PRN medication should not be routinely ordered each month, and again, it should not routinely be wasted each month. Remember, if you are discontinuing a PRN medication, to remove the PRN protocol. Here is an example of the PRN protocol and paracetamol timesheets that are available for you to use as a support tool. On the paracetamol timesheet, we can see that we've got the date, the breakfast, lunch, tea and bedtime, and here you would put the exact time the medication was given. Okay, and the total amount for each day is put there as well. So again, you've got a guide on how much of that medication should be administered. When required medications, information and documents. So PRN protocols should be in place. Check that each resident has a PRN protocol for every when required medication. This includes creams, inhalers, paracetamol, laxatives, okay? Always check that we've got a paracetamol time administered charts to record the exact time when the medication was administered. You may find these easier to use than documenting it on the reverse of the MAR chart. Body maps to document where the cream is to be applied and how often and to what area. So again, what we find doing our audits is that a lot of the PRN medications for creams don't have body maps to them. Controlled drugs can be required. Remember, Oromorph will expire after 90 days of opening, so always add the date of opening and include it in your date check-in audit. PRN medication should be carried forward each month and not routinely ordered. As we've said before, it is unacceptable to return unused medications each month to the supplier and at the same time request more supplies. Remember to check the expiry date on the box and not the date on the pharmacy label. PRN medication should be available throughout the day, not just on the medication round. Things to think about. Sometimes residents will refuse to take their medication. It could be because the medication is hard to swallow, it tastes unpleasant, or causes side effects such as loose stools or constipation. You can usually tell from the person's reaction that they dislike the taste or that the drugs can cause unpleasant side effects. Contact your GP for advice on alternatives. There are times where the person is more comfortable taking the medication in a particular setting or with the help of a certain member of staff. Think about your dignity and respect training when administrating medications to your clients. If the resident refuses the medication, we can offer the medication later, but this must be documented with the exact time on the MAR chart. And this does not apply to time-critical medications. Always remember the resident has the right to refuse. It is important to remember to document on the reverse of the MAR chart any results or outcomes. If the medication is a PRN or when required, this must still be in place. Do not be tempted to try hiding medications in food. Medication that's hidden in food is called covert medication and needs to be approved and have written consent in place. This should be documented in the care plan and documented on the MAR chart. Think about your MCA and DOLS training when administrating medication. Does the person have capacity to refuse to take their medication? If they refuse, try again later. Remember to document and report all non-administered medications and inform the manager. If the medication is refused throughout the day, talk calmly to the resident, explaining the importance of taking the medication and how it will help them before documenting it as refused. Remember, documenting all non-administered medication on the MAR chart is just as important as documenting when a medication has been given. This information could be important later. Always remember to wash your hands before and after administrating any medications and use the appropriate PPE. Remember to clean the medication trolley before and after each medication round. Replenish the Medipots, the giving spoons and the syringes. Think about your infection control training when administrating medications. Medication side effects. All medications discussed today have side effects, including headache, constipation, diarrhea, rashes and sores. To find out more about the medication, check the patient information leaflet in the medication box, or if you have a BNF book, or look on the EMC website online for all side effects, dosage information and overall advice. Remember to monitor the resident for any changes or reactions that may be caused by the medication and report your concerns to your manager. Always inform the supplying doctor or pharmacist if the resident is taking any other medications, including herbal medications, vitamins or supplements, or cold and flu preparations. And remember, if the resident has any allergies, these must be documented on the MAR chart. Thank you for joining today, and do we have any other questions?
Yep, so we've had a couple come through. The first one, if a resident self-medicates and is prescribed paracetamol and then takes the paracetamol without the 4-hour time gap, what is the protocol to follow?
Okay, so you would observe the resident, make sure their behaviour and everything is okay, report it to the GP. It may be the fact, report it to the GP and your home manager. It may be the fact that we need to look at this person self-medicating the medication, probably do a risk assessment on them, because if they're not allowing the 4-hour gap, the paracetamol will build up in the liver and it can cause really severe problems and lead to an overdose. So what I would say is document it, refer it to your home manager and do a risk assessment.
Is this a case of if it's a one-off, you might be okay, but if it's a repeat offence, you need to make sure that nothing serious is going to come from it?
It could be a one-off situation. Basically, they could have just forgotten the time, and that's why I would say review, document it, review it, refer it to your manager, because it could be a progression of their health, really. We need to do a risk assessment around it.
Okay, brilliant. Next question. If a service user asks for painkiller at 2 AM and no night staff member has been trained to do so, can a staff member who is not trained give the painkillers?
No. It's as simple as that. We need to have medication trained staff available at all time for that situation. We cannot expect a member of staff that is not medication trained to understand you know, the ins and outs of medication. So it's just a straightforward no. They cannot give any medication, not even a PRN.
Fair enough, makes sense. Okay, next question. Do I have to sign the MAR chart if the PRN offered is not given?
We have this in a lot of our care homes, and it depends really on what your regional team want to do. My personal opinion and what is good practice is that we only sign when the PRN is given. If not, then all we see on the MAR chart is a load of N's all the way across the MAR chart. It's best to, it just makes it really messy, really confusing. So I would always recommend just signing when you give the PRN. But that would be up to your regional team and your home manager. As long as everybody in the home is doing the same thing, that's fine.
Yeah, fair enough. As long as everyone's on the same page, you'll be
absolutely fine. But my guidance would be only sign when you give it, and with the EMAR system, again, that will only document when the PRN has been given.
Okay, perfect. Next question. You mentioned, and I'm going to struggle to say this, buccal midazolam.
Yeah.
Thank you. You mentioned that on training. Does this need to be stored in the CD cabinet?
We often get asked this question, and when I go around doing my visits to the home, I often see buccal midazolam in the CD cabinet. We don't advise putting it in there. It doesn't need to be in there. Buccal midazolam is used for seizures, and therefore it needs to be got quickly. So if you imagine this scenario, a resident is having a seizure, we've got to find the member of staff that's got the keys, we've got to unlock the clinic room door, we've got to go to the control drugs cabinet, we have to unlock that. We have to fill in the controlled drugs reg because we should have put it in there if it's in the CD cabinet. And all that time, our poor resident is having a seizure. So I would say keep the buccal midazolam, and it's good practice to do this where it is easily accessible.
Perfect. Last question that's come through. Where should the PRN protocol be kept? And do I need to read it every time before I give the medications?
So the PRN protocol should be kept with the MAR charts. So when you're giving that PRN medication, you should read the PRN protocol every time before you give it. There could have been a change on it. You need to understand the time delay, why you're giving it, what other things you should try to do, especially if it's something around anxiety. We should be looking at what's making that person anxious or restless, you know, and we shouldn't necessarily just reach for the medication, the PRN non-scheduled medication. So yeah, I hope that answers the question.
Okay, here we go. We've actually had a follow-up question to the one around being offered and not given. They're asking, if it has been offered and not signed for, how would it show that the medication has been offered?
Okay, well, if it's a PRN, don't know why you're offering it, really. You should be looking at that resident. So, you know, you shouldn't just be offering a PRN medication. It's not a definite dose.
So because it's something they don't have to have, we don't need to show it on the MAR chart because it's not something they have to have at a certain time. It's something that's when they need it. Okay. Okay.
Does that make sense? So if it's a definite dose, we always sign the MAR chart. But if it's a PRN medication, really, should we be offering them every time we give a medication? No, the idea is it's a PRN, it's when required. So we should only be offering it when we see that that resident needs that medication. So like I said before, we look at their body language, we look at their facial expressions. They could be holding themselves because they're in pain. They may reach out to touch you, to tell you something. We read so much by looking at a person rather than just the verbal communication.
Yeah, perfect. And that brings us to the end of all the questions. So thank you everybody for watching. Helen, if they do have any other questions, nothing we managed to get to in today's webinar, how can they get hold of you?
Okay, so they can always email me at helenberridge@prime-life.co.uk, or they can call me on 0791 704 5483. Just to add on to that, Michael, this was at the request of a couple of homes. They wanted some PRN webinars. So if any of the homes watching would like to send us what they like to be seen on a webinar, we'll put a presentation together for them. So thanks very much for the homes for sending in the nomination around PRN medication.
Yes, and as I said, thank you very much everybody for watching, and we should see you again in about 2 weeks' time. Thank you.
See you soon. Bye.
Bye.